Speaker. My question is to the Minister of Long-Term Health and Care. Minister of Health and Long-Term Care. Good luck on your appointment. Minister, 2 weeks ago I received a letter from our local community care access centre stating that the organization will be limiting the number of new patients it accepts less than 3 months into their fiscal. Your government has talked a lot about investing in community care-based service, yet 10 days after the election, our local CCAC is telling me they will be limiting the number of new patients in need of care. Minister, do you support Central West CCAC's decision?
Minister of Health and Long-Term Care.
Thank you, Mr. Speaker, and of course I do. It's just unfortunate that the party opposite didn't support our budget, nor did the third party, because in fact if they had, we have in that budget not only did we dramatically increase by $260 million our support to community care, including our CCACs in 2013, but we had laid out in the budget a further increase of $750 million increased funding to community care, including our CCACs, by 2017. So it was in the budget. Unfortunately, we had to have, as a result of the two parties opposite not supporting that budget in election to get us to this point. We are committed to our CCACs. We have invested over the past number of years a significant increase in our CCACs to make sure that we're providing that care, that quality care, to individuals and their families when they need it, where they need it, and as close to home as possible, Mr. Speaker.
Supplementary.
Minister, I understand that you're new, but this letter came out on June 23rd, which would be post-election, which would be post after you announced that the same budget is coming through. So clearly, the local CCAC is going to have the same problem. I understand you've inherited a number of crises in the health portfolio, but there really is an opportunity to make a difference here. This is a matter of priorities. Last week in the throne speech, we heard a lot of talk about building Ontario up. Well, I can tell you that in Dufferin-Caledon, we don't believe in building Ontario up by clawing back access to health care service. So I will ask the minister again, will you do the right thing and direct the local CCAC to prioritize their decisions to ensure that all patients are provided with the health care service they need when they need it?
I'm going to ask the member to withdraw. Thank you. Minister of Health.
Well, thank you, Mr. Speaker. And again, we are committed to our CCACs, and in fact, the funding to our CCACs has increased by 99% since 2003. Wow. We have further investments that we're making in the budget. I think this speaks to the imperative, Mr. Speaker, of making sure that the budget, which has been tabled, is quickly debated and passed in the coming days, so we can go ahead and continue to invest and increase our investment to this important aspect of the continuum of health care. Mr. Speaker, we know that there's always more work to be done. I'm very proud of the work that's been done in the past number of years to make home care and funding for supportive services. In fact, in our budget, as individuals are aware, we're increasing the
member from Dufferin-Caledon asked the question.
Personal
Order,
support
please.
workers, a key provider of our support services in our home care. We're increasing that by 30% over the next few years, Mr. Speaker. So there is more work to be done. We need to start by passing the budget.
That's right.
Your question, the leader of the third party.